Hello and welcome to another Healthy Ireland at Your Library Talk. Today we have with us Fidelma Rutledge from the Irish Motor Neurone Disease Association. Fidelma is a nurse specialist and she's going to tell us a little bit about her role in the association to begin with. So Fidelma, over to you.
Hi. Well, I've worked with the Motor Neurone Association for the past 15 years as a nurse for motor neurone disease. My role would be really as a patient advocate. When somebody is diagnosed with motor neurone disease, they're advised to register with the association, and then I'll touch base with them within a few days, and after that go out and visit them in their own homes. So we would start on the journey that they're going to have with motor neurone disease, and we'd nearly signpost them on where to go. So we touch base with the local services like the public health nurse, the occupational therapist, speech and language therapist, physio, whoever the person requires at any given time, we're able to signpost their way to it. So we're really the link between secondary care in the hospital and primary care in the community.
Well, that's great, because I suppose now everyone has a general sense of where the Irish Motor Neurone Disease Association fits in. So great to know that you're the first port of call. I suppose for a lot of people, they don't really know what motor neurone disease is, and probably the first they've heard of it was when Charlie Bird was doing his time up Croagh Patrick, and you know that sort of brought it to everyone's attention. But can you tell us, in layman's terms, you know, what is motor neurone disease and how does it impact people?
Really, motor neurone disease is, as it says, it is on the tin, it's a disease of the motor neurons. And the motor neurons are the nerve cells that send the messages from our brains to our muscles to tell the muscles what they want to do. So we'll say, as these motor neurons break down, then the messages stop coming, and that causes wastage and weakness of the muscles. So the things we take for granted, like walking, talking, breathing, eating, moving around or lifting something, all of those things can become pretty much impossible for people.
Okay, so what kind of physical symptoms then might indicate that you have motor neurone disease?
Well, that really depends on what muscles are initially impacted, what motor neurons are affected. So for some people, it could be simple things like tripping over, or it could be dropping things. For other people, it might be swallowing difficulties, or some people may present with a slurred voice, or coughing on things like liquids.
Okay, and can I ask you then, Fidelma, are there psychological symptoms that go with that? You know, would there be personality changes or something that might indicate that there's something wrong?
Well, for a long, long time, we felt that there was no cognitive involvement whatsoever with motor neurone disease because it is quite subtle. But over the last 15 years of research, we have discovered that up to 50% of people can have slight thinking changes. Now, they would present with executive thinking changes, like decision making can be a little bit impaired. They may be a little bit apathetic about their condition. It may not have the impact that you would expect the condition to actually have on them, and they may not recognize the impact that it has on the entire family. So we would have had families really report these changes to us, so we were able to study them more in research. For a small, very small number of people, they get what we call FTD, or frontal temporal dementia, where it's quite obvious that their thinking is very impaired. But for a large number of people, there is no thinking issues also.
Okay, so Fidelma, how is motor neurone disease actually diagnosed? You know, what kind of tests are done?
Well, for an awful lot of people, it would take about a year to get a diagnosis of motor neurone disease, because when somebody gets these very subtle symptoms like tripping over a couple of times and not knowing why, they'd present to a GP. So for some people, they're sent to an orthopedic surgeon, or they're sent for MRIs or bloods or all of these different tests that all inevitably come back quite normal. And then eventually, when a lot of things are excluded, they're then sent to a neurologist who will do a full neurological examination. And then they might have tests like EMGs, muscular testing, and nerve conduction studies done. But it's really a matter of eliminating other things and seeing how the disease is progressing before they'll actually get a diagnosis of motor neurone disease.
Okay, and then so once you get your diagnosis, so you've gone through testing, you get your diagnosis, what kind of treatments are available when someone has motor neurone disease?
Actually, we have very few disease-modifying medications. We have one in particular. It's a drug called riluzole, and this is shown through various different trials to slow down the progression of motor neurone disease. But what we do is we use other medications that were used probably for other conditions, and we use them to treat the symptoms of motor neurone disease. So we would have a drug, we'd say, for example, called amitriptyline. And this would be quite an old drug that was originally used for headaches. And it could also be used for depression. But the side effects of that medication is that it dries up somebody's saliva. And a lot of our patients would, they'd say that they feel they have too much saliva in their mouth. Okay. So this drug is quite effective in that. It also treats emotional lability. And a lot of people would say that they find it very difficult to control their emotions. So they might laugh uncontrollably, or indeed they can cry uncontrollably. It's just a symptom of motor neuron. And amitriptyline can greatly help that as well.
Okay. So you mentioned that, motor neuron disease, basically it impacts the impulses that are being sent through the body effectively. So how does the disease progress? What might someone expect to see as the disease is progressing?
Well, for motor neuron, for everybody, it's very, very different. So for some people, the progression is quite fast, and for other people, it's extremely slow. So it's from the diagnosis onward, we would expect the disease trajectory to stay at the same pace. So it's from diagnosis onwards that we would continually assess people to see the rate that it's moving, so that we can preempt what's coming next. But when you meet somebody initially, you can't actually say, we know what's going to happen, because you have to, it's about continual assessment. So if somebody's condition was progressing extremely quickly, then we can preempt that if their arms and their legs are weak, and then their breathing becomes weak, that their swallow will inevitably become weak quite quickly. So we manage it depending on the person, but it's not like other conditions where it's one shoe fits all. It's extremely different for everybody.
Okay, and so if let's say if you receive a diagnosis of motor neurone disease, so you might expect your arms and legs, the muscles to waste in those, as a starting point. Is it that you lose muscle mass, or you're losing control?
No, it's muscle mass. So it would be wastage of the muscles that people would experience. So once the muscles waste, then the arms become very, very weak. So I suppose in some ways you do lose control, but it's generally due to extreme weakness, but you wouldn't get abnormal movements or anything like that with motor neuron.
Okay, so if you have muscle weakness as part of this, what kind of allied health and alternative therapies would be useful in that situation?
Well, for the muscle weakness, the occupational therapist would be the first port of call, that somebody would need equipment to help them to maintain independence. So if you have weak legs, we'd be looking at a wheelchair that you'd be able to get to a countertop to be able to help you with things. Again, if it's weak arms, we look for particular wheelchairs like power chairs that you're able to drive quite easily. Also, we'd look at physio, because for a lot of people, they can get stiffness in their legs, or they might have a weakness on one side of their body, and that would lead to back problems, hip problems, because they're compensating, they're using one leg more than the other leg. So with motor neuron per se, there isn't pain, but there can be pain if somebody is walking the wrong way or they're pulling the muscles that they have left. So a physiotherapy. Then we'd also look at speech and language therapists, considering, you know, somebody's swallowing difficulty, and also a physio can be really good to assess somebody's breathing. So we greatly use the allied health professionals. Without them, we're useless on our own. We're there to signpost, to pull people in, and to have the patient in the center of the circle and us all around them to be able to guide them through the condition. We also, for people, they go into the hospice and they get the alternative therapies like the massage, the reflexology. Now, none of these things are been proven to extend life, but they're certainly been proven to enhance life. So we're open to those, anything. You can't do any harm to motor neuron. You know, if you're living within reason and you enjoy a massage, then we would encourage people to have them.
Great, great. Oh, it's good to hear the, you know, the positives as well with that. If someone receives a diagnosis of motor neurone disease, obviously it's going to be very traumatic for them, because, you know, anyone who's told that they have a life-limiting illness is going to be challenged. But it can also be a challenge for friends and family, because they don't know how to react and what to do. So, you know, what would you say to family and friends and carers of someone with motor neurone disease? How can they help? What steps should they take?
I think for any family, it's a traumatic. It's absolutely, it's traumatic in a home. It's like a car crash has just happened. So it's okay to grieve with the person that's diagnosed. When we go into people's homes, you know, we have family members that say, I'm trying to stay strong, I'm trying, I don't want them to see I'm upset. I'm always saying, but you are upset, and it's okay to share that. I feel we provide counselling for people. We support people with it, and from there on in, it's literally about doing the practical things for people, helping them with the paperwork that needs to be done that a condition like motor neuron brings in. We're looking for people to get medical cards, primary medical certificates, maybe adaptations to the home. There's an awful lot of paperwork that has to be done, and that's the practical stuff that people need help with.
Okay, so family and friends, you know, a practical thing they could do is help fill out forms, help do the research on what's required to get the supports that people might need. In terms of coping then, you've advised the Motor Neurone Disease Association you provide counselling. Are there any other things that people should be doing? Obviously, it's very difficult, you know, if you have a family member who's been diagnosed with this, as you say, it's like a car crash. Your life is going to change, and it's going to change dramatically. And not necessarily in a particularly long period of time either, because it can, as you said, progress quite quickly. Should, you know, aside from obviously getting counselling with yourselves, are there any other supports that people can tap into, maybe through the HSE or different associations that provide support for carers?
Yeah, Family Carers Ireland are extremely good with people. Also, we have a helpline, and people use that very, very much. You know, I think it's the fear of the condition that's as bad as anything else, that people are sitting at home and they're fearing the future, whereas a lot of these fears are actually unfounded, and we're there to relieve a lot of those. We're also there, we're doing the home visits all the time. There aren't really support groups for people with motor neuron disease because it is so diverse. It's very, very different for other people. So as such, the support groups, even though they have been started, sometimes people come out really bewildered and saying, is this going to happen to me? Is the other thing going to happen? So what we have is a hub where you can literally type in your own issues and people can come back with answers for that. So that's also really beneficial. There is the MND clinics that happen around the country as well. There's one in Galway and Cork and Beaumont. And at those clinics, it's nearly like a support group as well, where you're meeting people with the same condition and you're able to, you know, troubleshoot a lot of your symptoms there.
And are those in-person clinics or are they online?
No, they're in person. They're in person. There's one every week in Beaumont, and there's one every second week in Galway and in Cork. So people are followed up very, very regularly. There's nobody left on their own with motor neuron now if they're open to coming to them.
That's really fantastic. That's super to hear. You mentioned a helpline. Do you want to give that phone number?
Yeah, it's 1-800-403-403.
Great. So you mentioned there that there aren't really support groups for motor neurone disease, but the Motor Neurone Disease does provide these clinics, which is great to hear. Is that just for people suffering with it, or can family and friends come along as support and to learn more?
Oh yes, we would encourage family and friends to come. And then every year we have our annual AGM. And unfortunately, that's been off for the last couple of years because of COVID. So we're delighted to say it's back again. And that's where we invite all people living with motor neuron disease registered with us and their families to come to a hotel in some part of the country, and we stay overnight and we have lectures about different things. It might be Family Carers Ireland, it could be from the research guys in Beaumont, it could be on various different alternative therapies, things that actually relate in some way to motor neuron disease but are of interest to people. And that's a really good meeting place for people with MND, because this friendship's been formed from there that you'll hear the next time you go into somebody's house. They're saying, I was talking to the people that were at the AGM, and it's a really personable way. It's in a relaxed environment and it's in a hotel, so you can meet people if you want to, or you can just sit on the sideline and be an observer.
That's great. And when does that take place, or when will that be taking place this year?
September, generally September, yeah.
And the dates, if someone wants to be made aware, is that publicized, or is it just to people who are registered with the association?
Anyone that's registered with the association get their invite sent out.
Right, super, that's wonderful. I suppose moving away from the personal and more to what we as a society can do for people with motor neurone disease. you know, how do we make our public spaces more inclusive for people with motor neurone disease?
Well, I think we have improved greatly as a society. I mean, if we look at any of the new buildings that's happening now, that's been built, they're all wheelchair accessible. So that's a positive thing. I think as a society, it's about us looking around a little bit more, about being more aware of what we're doing when we park on footpaths, and, you know, are we going to impede somebody that's in a wheelchair? I mean, we're all very aware, you know, a bicycle can fit by there, or maybe a pram, but maybe a wheelchair cannot fit by there. Maybe when we park and there's a slope on the footpath, maybe that's somebody's only way of getting across the road. And the simple things we can do, like just taking a glance over our shoulder to see if somebody is coming behind us that we could hold the door for. So there's a lot of things we can do, but certainly if you're thinking about having an event where people are coming, that it's really good to do a trial run, first of all, just to go somewhere, if it's to a restaurant or something, and say, well, look, if I pick this restaurant, I actually can't bring anyone in a wheelchair, which is very, very unfortunate. And we've seen it with people with motor neurone disease, where they're saying, I actually can't go to that wedding because I have no access. And you know, but I know that the newer places are really, really stepping up to the plate, which is absolutely fantastic. And the older places, there again, they're doing their best to try to accommodate people, but maybe as a society, they were just more aware that when we're driving, that if you see somebody in a wheelchair, you're going to give them a little bit longer to cross the road. And then people with motor neurone disease, they don't mind being asked if they'd like help. Can be as simple, if they have something on them, do you want me to carry it? Would you like me to carry it? Would you like a hand there? People aren't offended.
I think, well, that's good to know as well, because I think that's something that, you know, we are, I don't know whether it's a particularly Irish thing, if I may say that without getting into trouble, but we can be a little hesitant, I think, because we're afraid of giving offense almost by, you know, asking the question. So it's good to hear that, you know, that is welcomed, you know, and that we should be making all of that effort, because I think we all know, you know, we should hold doors, we should, you know, be more conscious of these things, but sometimes people can feel, you know, they wonder how it's going to be, what kind of reaction they're going to get, you know, if they say it. So that's very good. I think your point as well about the, you know, parking is a big thing. You know, people go, I'm just here for 5 minutes, but those 5 minutes mean that someone in a wheelchair can't get past, can't get to where they need to go. That's definitely something, you know, we can all do, is just be aware of our surroundings and parking only in the designated areas. The other thing, and you mentioned it, you know, is access to restaurants, things like that. So in terms of outdoor seating, I guess that people would be aware, if they are putting out tables and chairs outside coffee shops, outside restaurants, that they make sure that they leave sufficient width on the footpath for people to be able to get safely past. And again, you know, we would have seen a video a little while ago in Galway of a wheelchair user having difficulty navigating some of the footpaths because they were completely blocked with tables and chairs. So it's just being aware of not impeding access and things like that. Moving on from the public space, then I guess the next question relates to the duration of the disease. So, you know, what kind of time frame are you talking about? Because it is a terminal illness. So what would be the average expectancy in terms of, from diagnosis to end of life?
Well, unfortunately, motor neurone disease is also known as the 1000-day illness.
So in terms of that, I suppose that time frame, it's short, but it's also maybe long enough to plan and, you know, make preparations, which is an important part of any, you know, any chronic illness, any terminal illness. You need to plan ahead. You need to think about, you know, what decisions you want made in relation to your care, in relation to, you know, what's going to happen with family members, maybe if there are young children involved, things like that. And we, I suppose you have a document called the Think Ahead document. Do you want to maybe talk a little about that?
That's a hugely valuable tool for people, for anybody that's facing into a life-limiting illness. It's certainly something when we initially diagnose somebody, we wouldn't look at it. We encourage people to live in the moment. But when it is time appropriate, it is something that we do introduce to people. And this document basically allows the person with the condition to plan and to hold autonomy over their own condition. For family members, they can be very hesitant to discuss end of life matters. Obviously, it's very, very personable. And but we don't want any family member second guessing the wishes of their loved ones. So when it is time appropriate, we do introduce it, and it basically is a step-by-step approach to planning end of life matters for somebody. For a lot of people, they'll say, well, I don't really care about the music at my funeral, you know, but for other people, it's extremely important to them. They might have been part of a choir and they might be saying, actually, I want this person to sing at it, and no, I actually do not want to be cremated and things like this, you know, that maybe we've never had that conversation at home, but it's something that somebody can plan for themselves. So afterwards, their loved ones can say, I've done everything that my mom, dad, brother, or sister, or husband wished. So it is an important document. And it's also for medical care people as well, that we can say we know what that person wanted when they can no longer speak for themselves. Because for a lot of people with MND, their worst fear is that they're going to arrive into A&E and that nobody is going to understand what they're trying to say. They're going to be so unwell that they can't use their communication device. And your life is left in the hands of complete strangers that are trying to do their best, but maybe that's not what you want. Maybe you just want to be kept comfortable. So with this Think Ahead form, it's recognized by doctors, and they do use it as a tool to help people to maintain the autonomy and to ensure that their own wishes are carried out there.
Yeah, and I think that's very important. You know, you mentioned that family need to be aware of that. It's very important that those discussions take place with family as a group, so that everybody in the family is on the same page, and you don't have a situation where one family member says, well, I talked about this with dad or mum or whoever, and they wanted this, and someone else says, well, oh, but I think something different. So that's the advantage of the Think Ahead form. It encourages those conversations to happen, but it also, you know, those discussions do need to happen with everybody in the room. Yeah. So that, you know, there aren't any difficulties or challenges at the stage when everyone needs to be focusing on the person with motor neurone disease and what they wanted. As you say, it's about getting their wishes known and making sure that those decisions are respected by family and by the healthcare professionals. And it's very helpful all around. So it's great to know that that's there. And is that available from your website?
It's available from the hospice. Through from the Irish Hospice Foundation would be able to provide them. We carry them in the boot when we're going to people's homes, because like that, it is time appropriate. And when the time is right, we need to have them at hand, you know, to be able to to discuss them with people and go through them, and for them to understand everything doesn't have to be filled out. We don't expect people to know exactly what they want, but we want people that have strong feelings about things to be able to put that on paper and that will respect them.
Right. One, I suppose, thing, and I'm going back to something you said earlier, you know, it's about, you encourage people with motor neuron disease to have quality of life. And I think that's really important, because, you know, with any illness, there's that fear and maybe an attempt to sort of, do I suddenly have to stop doing everything that I enjoy? And again, you know, Charlie Bird hiking up the side of Croagh is something that some of us who are, you know, in the full of our health couldn't manage. So, it's, you know, I think that was actually really inspirational for people. In terms then of, you know, what would you recommend? So someone has been diagnosed, you know, what do you tell them about, you know, continuing the activities that they enjoy and they love to do?
What I would say is, you're still the same person. You know, you were living in the moment last week, continue to live in the moment. Don't stop making plans. I think for a lot of people, they're given a diagnosis and they say, I'm not able to go on the holiday that I expected to go on in 6 months' time. But I'm saying you probably had motor neuron over the last year and it wasn't stopping you from going. So don't stop making plans. You know, that's not what motor neuron is about. It's about living with it. They're not dying from it at that stage by any means. So they need to live in the moment. Don't change anything you were doing within reason. Not everyone with motor neuron disease will be able to climb a mountain, but I was on the rig that day and there were so many people with motor neuron disease at the bottom. They were saying, you know, you're doing it for us all. And, you know, a lot of those people could speak, but they weren't able to climb. So it's very, very different for everybody. But I think it was a very special day because there was walks all over the country that was being done for different people. And, you know, it just showed people that they were still an integral part of the community. And I know the one in Croagh was really highlighted, but there was so many other walks that it just showed there still is quality. Even though somebody has motor neuron disease, society hasn't forgotten them, their community hasn't, you know, forgotten them, and they were out walking and forth. So it was very emotional for an awful lot of people.
Okay, so continue, keep doing everything that you would have done as long as you're able to, basically.
Yeah. Yes.
And don't stop making plans. I think that's a fantastic way to finish it up. It's a really nice point. Don't stop making plans just because you have this diagnosis or just because someone in your family has this diagnosis. Keep going. Do you want to say any last words, Fidelma?
I just like to say, even with a diagnosis like motor neuron disease, which is horrific, but there is still quality of life. And people should not give up hope. There's an awful lot we can do for it, and we continue to do for it. And I meet people when they're initially diagnosed, they're absolutely traumatized. Meet them a year later, and they're living life to the absolute full. You know, they're a lot more disabled, but their quality of life is extremely, extremely good.
Great. Fidelma, thank you so much for being with us today. That was really, really great to talk through all of that and get that guidance. For anyone who is looking for help, as Fidelma has said, there are clinics through the Irish Motor Neurone Disease Association. You can access their website at www.imnda.ie. And Fidelma, will you just give that helpline phone number again, please?
Yeah, it's free phone 1-800-403-403.
Great.
Thank you so much. For everyone watching, we will have more Healthy Ireland at Your Library talks coming soon. So please keep an eye on the Galway Public Library's social media channels, Facebook, Twitter, and we will have new content coming for you soon.